This
Yes.
conference will now be recorded.
Hello, everyone, and welcome to our AnCan Blood Cancers group. It is June. Yay, it's summer, or at least unofficially, right? It's unofficially summer. So thank you all for joining us. And for those of you who are watching us, thank you for being here. I'm Michele Nadeem-Baker. I am in Boston, and I have CLL, known as chronic lymphocytic leukemia. We have a lot of people here from a lot of places. Well, not so many yet. People are coming in, and I'd love to hear who needs some time this evening to speak.
Well, you have one new gent.
I
Yeah.
do. Oh, Jim, you need some time, and so is this your friend that you have brought along?
Um,
Yes,
I don't know
invited
Jim at
him.
all. He's no. I'm a newbie, so if I could get some time, I would appreciate that. But that's all right. I can wait until the
Absolutely. No,
middle.
absolutely. You're going to get some time tonight.
Okay.
And you will. After we go around and see who needs time, you will be first up.
Whoa.
That's a lot of pressure, but Jim's right here. So,
Yes.
Lou, I believe people would love to hear. Okay.
Yes.
Jim, you said you need time. At least I thought that was you had raised your yes. Mary Lou, we want to know what's happening with you too. Time?
Good.
Okay. Nancy. Nancy, you froze, but do you need time or I can come?
it's at least flattering. It was flattering. So, that's good. It's
Is that?
always good.
Oh, maybe Nancy will be back. Okay, we'll ask her. Rick and Alexa, do either of you need time this evening?
Oh, well, Nancy's back.
She's back.
Um, I will just have we checked? We've checked with everybody. I will
Not
kick off
Nancy
by.
yet. Nancy's
Oh,
back.
not Nancy yet. Well, after we've
Yeah.
checked with
Okay.
Nancy
Okay.
yet, yes, I
Perfect.
would like to just kick off.
There you go.
Okay.
You can go. We're good.
Okay. So I want to kick off because I truly want to welcome Lou as a moderator. Lou has been with us for how long, Lou? Three
I
years,
think
4 years,
3 years. Yeah, I think 3 years now.
3 years. And we are so happy that you've accepted the role to add to our moderator. We are short. We lost my dear buddy Al, and we were definitely short. Um, and so that's the first thing I want to say. The second is I will hang in for a little while because I like to go over to my Speaking Freely meeting. But a couple of, um, we have a newbie who I would just like to say that we've supported Dan Straub in our prostate cancer, high risk prostate cancer group for some months now. How long, Dan? How long is it that you've been coming to ACAN?
About a year and a quarter.
About a year and a quarter, and we've kind of straightened him out a little bit
Yeah.
in at Kaiser where he's treated, and I think he continues to need a little. It's not so much him that needs straightening out; it's the Kaiser docs that need straightening out as usual, and um, and so we've connected, given his diagnosis, we've connected him with a couple of other people like Derek, who just came in, and another very close friend of mine who's on our advisory board. And he's getting more and more information. And I suggested to him that this would be a very good place for him to be to learn a little more about his situation that he'll explain to you. And so that's how come he's here. And of course, Dan knows Jim, not just because they're in Alexandria, but I think it might have been Jim that got Dan into AnCan in the first place.
Right.
So to our prostate cancer group. So that's the background, and I will hang in for a little bit, This is the third night in a row that I'm seeing Mr. Martin in our group. It's a pleasure. I
I'm
will.
just glad Derek's not in the bed this time. I'm happy to see that.
Yeah, and Derek, I checked, and I was right, and about your teeth and Paxlovid and everything. So you guys need to talk offline. You guys need to connect and do a little. But I was right about what I thought. So there you go. Over to you, Miss Michelle. Who, by the way, don't forget, Michelle is hosting a patient power. What is it exactly, Michelle? We should put it in the
Patient
chat.
Power did a survey on mental health and emotional health in cancer patients. So my next program is regarding that and the results, and we have some fascinating information to share, as well as a leading specialist, and that is on June 18th, I believe. Hold on, at 1 p.m. Eastern time, but let me just double check I have the right date.
Sounds about right. We did put the information in the reminder, so go look at the blood cancer reminder, and you'll find show up and support is Michelle. Oh, and Alexa's just put it in. So over to you, Michelle.
Thank you, Rick. Appreciate it. I feel like we're on a television program. Thanks, Rick. Back to you, Alexa. Hi, Barbell. Good to see
Hi.
you. Will you need some time this evening?
A little bit, yep, but
Okay.
not very much.
Okay.
Also, Michelle, I want to say real quick, Sally was on very early. She had wanted to be with the group. She is very, very ill. Lou could maybe touch on that just a little bit, but she wanted to let everybody know that, she wanted to say hi, but I told her, please just go lay down and we would share the message she wanted.
Yes, Lou and I saw her yesterday, and she was not sounding too good, but once she got chatting, she was in better spirits. And it is Lynn Bailey's 55th wedding anniversary tonight. So happy anniversary to Lynn and his lovely Shirley. They're out for dinner this evening.
Oh, okay.
So, but you never know with Lynn. He could pop in later. Okay. So, Dan, we would love to know about you and what brings you to our group this evening.
Well, I'm used to Rick lighting into me about all these questions. So instead, I'm going to turn the table since you asked me. I'll just try and fill you in a synopsis way because I know people want to talk. I'm 77 years old, and I was diagnosed with prostate about a year ago. And if you want, I can go into the details of that. But I went through, instead of surgery, AnCan got me out of that track. Even though family members, I was all set to do the surgery until Jim and Rick took me under their wing, and Jim put me into a book, and AnCan got me into the right track. And I decided not to do surgery, but last year I did radiation therapy and hormone therapy and seemed to go flying colors through that until around December, this past December, and the side effects started to hit. And one of those about in March, they did an MRI because I started to have issues with my hip groin area. And they had four different potential options, two of them most significant, an insufficient fracture, or it could be an extension of cancer. And as we all know on this screen, as soon as the C word comes up, people get nervous. It's just something we got to live with. So it wasn't until the past 3 weeks when I finally caved in and I did another PSMA. They would not do a bone biopsy without doing a PSMA again, and that was negative. And then last week they did the bone biopsy, and that was negative. And surprise to surprise, I thought maybe I'm going to get out from under this terrible thing I've been dealing with. Till Monday, when my oncologist, my medical oncologist, said, "No, we got to do another bone marrow biopsy because of the MGUS." And it wasn't until Rick and some other AnCan members had conversations with me that I decided to push back. I was ready to push back myself, being an advocate. And with that additional advice, I decided to push back to the oncologist. Why do you need to do another biopsy? And she relented. She said, very good point. And then she finally conceded it's a very small option, a very small chance that I have it. So essentially, I think anybody with MGUS is going to live with it their whole life. It's just that there's only 1% chance that it's going to lead to full cancer, myeloma, or whatever. And I think that's where I am right now. I'm trying to make this a synopsis without giving you a lot of detail, but I can give you more. I think that's pretty good idea where I am today. You're muted, Michelle. You're muted.
I'm sorry. Did you say M2 US or MD?
MGUS, MGUS, monoclonal
Oh,
gammopathy.
Gammopathy.
oh, okay. And what percent infiltration was there? Did they give you any figures on that, or just that they detected it?
They detected it with the blood test, and I wasn't prepared to give you the numbers, but I do
That's
have
okay.
them here.
If you don't have them, that's fine. I was just curious if you knew. That's all. This is not my area of specialty, although I've covered it. Lou would be the person here, and I don't know if there's anyone else here this evening as well, and Derek. So, so what did they told you? There's a 1% chance, and anything that you need to do in the meantime?
No, they didn't say that. They don't give you that kind of information. She said that she was concerned about the extent of this, and she just wanted to prevent me from going future into it. Never talked about the treatment. Essentially, she was being very conservative, knowing that I it was showing up in my blood samples. And I thought last biopsy last week was going to cover that. It was for a whole different issue. It was a bone biopsy for cancer, small cell cancer, not MGUS, which would be a different biopsy in a different part of the body.
Okay. And so, with the bone marrow biopsy, have you gotten the results?
I decided not to do that, and she relented also. She doesn't think it's needed. I pushed her on it. She was very active. I needed it. But when I told her with this advice I got from other members, a friend of Rick's and also another member of AnCan who went through the biopsy and told me it was an introductory doctor at Johns Hopkins and it was very painful and he had very bad things to say about it. And Rick's friend in California had never had it. He's had all the other blood tests and he highly recommended I didn't need it. Not that I want to listen to another person over a doctor, but what I've learned with AnCan is sometimes the doctors just want to get you on the slab or just want to get you in. And sometimes you have to be your own advocate to learn things, test information, educate yourself, and then ask good questions. So that's where I am right now.
So yeah, Dan, 16 years ago, I was diagnosed with MGUS myself. At that time, I believe it's the kappa lambda ratios is what they look at.
Right, one of the three. One of the three.
Correct. And it was very minimal at that time. I believe maybe about 2 or 3 years into that, I did have a bone marrow biopsy based on my oncologist's recommendation. It was done in an office setting, and it was not that unpleasant from what my perspective was, at least. And then slowly the numbers have been increasing. Here we are 16 years later. And now my ratios are dropping, and that's the key, is that when the ratios drop, then showing that you are maybe sliding towards a smoldering multiple myeloma at that point. At which point we did do another bone marrow biopsy maybe 2 years ago. And fortunately, that showed nothing in the out of the ordinary, out of the extraordinary, I should say, in those results. Again, the biopsy not being that detrimental or that painful. I would say that the prostate biopsy that I did in office setting was totally way worse than the bone.
We don't need to talk about that. That is definitely 100% painful.
And I'll mention mine was transrectal as well. So yes, definitely more difficult to get through. But yeah, the key is just watching those ratios.
Right.
Definitely. And what age are you, Dan, if I could ask?
I'm 77, but also you mentioned about the ratios, but that's done with the blood test. And how often do you do the blood test?
I'd see him, I think, every 6 months for the blood test. Correct. So we're monitoring that every 6 months, as well as my pancreatic cancer that I'm a survivor of for the last 4 years. I also do a blood test on that every 6 weeks to look for any markers, tumor markers that could be potentially showing up based on my BRCA1 finding originally. I did go through a Whipple procedure, and I'm here to talk about it going on 4 years later. That was September of 21 that occurred. So,
well,
you're
looking great for all of that.
I drew the trifecta, definitely.
Right. Well, you're dealing well with it. You look great.
Thank you. And I'm just a blessed man, and just trying to stay active and busy. And I think the activities and staying active is the key. Now, I was diagnosed with MyMGUS at age 50, so pretty young at that point. And it was just found by mistake because I was going through another situation where I was enduring valley fever or coccidiosis, which is a fungal infection in the lungs. That took about maybe 3 months for them to finally get down to a proper diagnosis on that. And I was almost on my deathbed based on that. And then along the way, the protein showed up in my bloods samples, determined the MGUS at that point. Yeah. So again, the biopsies weren't that bad. So you had a bone marrow biopsy, but that was
I had a bone biopsy, not a bone marrow biopsy.
Oh, a bone biopsy. My bad. I see. That I would think would be even worse than a bone marrow biopsy.
I was prepared that it was going to be tough. It was smooth sailing for that. I was in and out. It's more painful now dealing with the body reacting to it with the needle that went through, etc. But I'm recovering.
Okay, good. So again, here I am, 16. Go ahead, Rick.
I think I'd like to hear from Lou because Lou knows more about this than anyone else in the room. And Lou, as a moderator, please feel free to jump in. Okay.
I was just listening for right now.
Yes, but you're free to jump in. And I think that the big issue to focus here is that the oncologist was very ready to jump right into a bone marrow biopsy. And there was enough knowledge in of all places, in the prostate group to say, whoa, wait a minute. I think you need to ask and push back. And then I stepped in and connected Dan to my buddy Fred, who lives a lot closer to Derek than he does to Dan, and he's been wrestling with MGUS a while. And I said, you got to come into this group and hear what they've got to say. And we've heard from Derek, so really like to know.
Before Lou steps, I would say though it is critical to get a baseline. You do want a baseline where you start with. Go ahead, Lou.
I was just going to say that there are several people that I'm connected with that have MGUS, and it's a variety of approaches that their medical teams are taking. And you're right, Dan, you have to be very proactive, and be a outspoken member of your team, because this is your, you know, it's your team. It's not the doctor's team, and it's not the medical facilities team. It's your team who's helping you. And it took me a long time to feel that. I think, you know, I'm not of the age quite that you look toward doctors as, gods, or, they don't make any mistakes, or, anything. I'm past that. But I do think that when you are given a diagnosis, whatever it is, you are in shock for a while, you know, and so you do listen a lot, and you do take the advice of your medical team and your doctor recommendations. So in the beginning, you will do a lot more than maybe you would after you learn more and become a part of your team, truly, a part. And if you're lucky, you have a doctor who is very interested in his patients being advocates for themselves. And I am lucky to have that. But I've had 32 bone marrow biopsies.
Wow.
So, yeah,
Oh,
and never without sedation. But I have to say that the sedation part, it is only administered at the very last moment when the doctor walks in the room. And if they don't start your IV for your, anesthetic right away, you feel the beginnings. And I've had about 5 of those 32 where they did not start the IV right away. And I felt the Novocaine go in, which is
mm,
like, I think, one of the worst parts is feeling that Novocaine go in. And then the actual during the procedure, if they don't continue with the proper dosage of the anesthetic, I remember being kind of awake at about the middle, and I felt the pressure, and when they were actually doing the biopsy, and I remember shifting a little, and they'd say, be still, be still. And I thought, put me out. Give me more medication to put me out. So I have to say the majority of the bone marrow biopsies have not been bad. I mean, I don't really remember a whole lot. They call it like being in twilight, where they don't put you totally out. They just get you to a stage where you don't feel, the pain, or I should say, remember the pain. So I know that there are brave people out there, and it sounds like Derek has had one in the office. Kudos to you. I would never do that, because I'm a baby. I always tell them, when they're checking me in for the biopsy, I'll go, I'm a real big baby, and so I have been known to holler if it starts to hurt in the room, which I have. And so they'll go, oh, so they'll give me a pre-med, that kind of helps relax you. And then the anesthetic, of course. So I always do it under anesthetic. But as far as MGUS, I have to say that I have many friends and connections with people who have MGUS. Obviously, Derek understands about, how many years you can go, with just it staying at MGUS. There are also connections that I have that it starts to show up a little bit more in their numbers when they do their labs. And you're right, they don't typically start treatment for MGUS unless your numbers start to increase, considerably and maybe quickly. And I do know that there are clinical trials for people who have MGUS who want to do some of the trials that they have are, is it advantageous to do treatment earlier, so that they're assuming it will eventually, go into full-blown multiple myeloma. But what they're doing is doing, clinical trials that people can apply to, and if you qualify, then you could become a part of that treatment, options. So anyway, I have to say, Spark Cures is about the best place to get information on clinical trials. So I have found 3 of my 5 clinical trials that I've gone through. I'm doing the 5th one right now, but Spark Cures, and it's just the way it sounds, SPARKS, and then CURES, Spark Cures. Yes, thanks, Alexa. And it is an organization that is remarkable and is a place where I have found friendship, with a lot of the people I talk to. Gail at Spark Cures is awesome. She checks in on me all the time, and she celebrates with me, when clinical trials are working and going well. And she also commiserates with me when it's not going so well. She's just an awesome person. Brian McMahon is the person who started the website Spark Cures for clinical trials because his mother was diagnosed, and I believe it was with multiple myeloma, blood cancer, and they could not find information easily for her. They were interested in a clinical trial. The .gov, clinicaltrials.gov, a lot of people know about that, but it's not user friendly, and Spark Cures has been so much more, as far as helping you locate clinical trials. So those are the things I wanted to share for those of you that have MGUS.
Follow-up question, Lou.
Yes.
How long did the clinical trials last for you? And what's the response that your body's getting?
I have had 3 CAR Ts, and the first one was 13 to 14 months in remission, and then my numbers started to increase. The good thing is they don't do anything. They don't do any other treatment right away because they don't want to mess with your T cells that are still working. So it ended up being about 2 years that I did not have any further treatment after the first one, and it was a CAR T called Abecma. The second clinical trial, or CAR T, was an allo, so it was using someone else's cells. That only lasted 6 months, and then my numbers started to increase. And now I'm on, this trial is addressing a different marker on the outside of the myeloma cell called GPRC5D. And it is officially today, I'm in remission. I had a visit today and at the cancer center, and my numbers are still continuing to go down. The protein in my blood is less than, it's not measurable at this point. So that's exciting. Yeah. And I'll have a bone marrow biopsy again at 100 days for the clinical trial.
Great.
That help?
Yes.
So Luke, was your original diagnosis multiple myeloma or MGUS?
Well, I was teaching still and was diagnosed that evening. I was driving home from school and I thought I was going to have to pull over. I became so tired. I thought I was going to have to call my husband to come and get me off the side of the road, and I had not been sick, nothing. I had no cold, no sick, nothing. I was working, was teaching. And so it was out of the blue for me. And then when I got home, I fell asleep on the couch. And with my husband, he is also was an educator. he came in and saw my red face, and I was asleep and disoriented. I had 103.4 at that time. That was about 6 o'clock, and I had gotten home from school about 4:30. So in that short period of time, it escalated to that high temperature, and he said, "We're going to the emergency room." And so when I got there, I found out after a few hours of tests and things and x-rays, I had double pneumonia. And when I was treated, with all kinds of steroids and antibiotics, and after 5 days, I was very much improved and got to go home. But before I was dismissed, a hospitalist came up to my room to talk to me. And she said, by the way, you have an elevated level of protein in your blood. And so I'm sitting there not knowing what that meant. I had no idea.
Hey, all right.
Yeah, I know. And I was like, yeah, is that good news or bad news? And she said, you need to be retested in 2 weeks by your own local internist. And so and she said, it could be MGUS. And that's what she told me at that time, just from looking at the blood labs. And so I was like, okay, I have no idea what MGUS is. This was over 12 years ago. I had no idea what MGUS was. I did not know, but I started to tear up because it sounded serious. And she looked at me, and this is one of the stories I tell. David and I have written a book, by the way, about our journey. It's not published yet, but the editor has sent it back to us and finished the edits. So it goes to the publishing company in the next week, and hopefully by the fall, I might have it. But anyway, it was this doctor, this hospitalist said, don't do that. That's what she said to me when I was tearing up about the news that I had MGUS. And I was like, what? And she said, I have patients that are much worse off than you. And I thought, oh my God, how rude. But I was in shock. So I did not at that time respond. Had my husband been in the room, I'm sure he would have, but he was not there at that time. But anyway, from that point until the time I went to the internist, got retested, and then had referral to an oncologist hematologist, and found out I had suspicion of having cancer. It just hit like a rock, just tons of rock on you. I was in shock, but they said it was full blown multiple myeloma. So what the doctor at the hospital saw after my myeloma, my double pneumonia, she was just guessing from the numbers. So I believe, even from the onset, that it was all full-blown myeloma.
Okay, thank you. Jim, you were going to say something earlier.
Yes, and MGUS, I know I've seen it in the PAC deck for the veterans, and I was always curious, what exactly is it, or or it's a starter of something I'm gleaming out of the discussions. Could you kind of explain it in simple terms?
It's just a precursor. It does not always. It's just you have blood markers that are concerning
Okay.
or get a doctor's attention.
It's an excess monoclonal proteins in the blood.
Okay.
Okay.
The problem
I wasn't sure if that's what he was looking for.
Yeah,
one of the
right.
doctors explained to me when I was diagnosed, he said, it's like you have, these plasma cells that are multiplying. He said, but the problem is, everybody has plasma cells that multiply. We need that. But what you have happening in your blood is, and bone marrow, is these cells are like teenage cells who they never mature, and
Oh,
they crowd out good plasma cells.
oh,
So
White
when
cells
he explained
specifically.
that to me, I thought that was a good way to explain it and look at it.
Correct. Yeah, these monoclonal cells tend to crowd out the white cells, which are your antibody cells, your
oh,
your disease fighting cells. And in the end, what happens is those cells dissipate the white cells, and you typically will succumb to some sort of disease or infection, and that's what does you in. It's not the actual cancer itself or the multiple myeloma. It's potentially this other disease that you can't fight anymore because you no longer have a good number of white cells within the blood.
okay. Okay, thank you.
Lou, thank you for sharing about your own story. In the beginning, I never heard that. I look forward to reading your book when it comes out. We'll have to have a launch party for you. Uh, all right. So, Dan, any other questions and about this? And when is your next doctor's appointment or your next test?
I do a monthly blood test. Usually I do it on the first of the month, but I'm holding off a little bit until next week. And I also got some other indication besides PSMA or PSA. They're going to monitor a lot of other things. But I have a follow-up question to Derek and Lou, if I may, Michelle.
Of course.
I've got the spreadsheet here of the new blood tests that they did. What is the serum-free kappa and alpha, kappa and lambda light chains that I should be looking for in terms of the numbers? The same with the immunoglobulin G, A, and M, IgG and IgM, IgA. I know the ranges, but what's your feeling of what's a number to be worried about?
It depends on what kind of myeloma you have, or MGUS, what they have said. I have IgG kappa
Hmm.
MGUS, or not MGUS, I'm sorry, myeloma. And so my doctor monitors the kappa number. And the clinical trial I'm in, my kappa number had to be 10 or above to be a part of that clinical trial. So my doctor has always said, if your kappa, for me, if your kappa number gets to 10, we need to start some type of treatment. The
That's
ratio he doesn't look at as much.
the kappa light chain you're talking about.
Yes,
Is that correct?
yes.
For
Now
me,
I
Dan,
know that there are people that the ratio number is what the doctor is more concerned about. But for my particular type of, and that's why I say you need to know what particular type of cancer you have, blood cancer, myeloma. And then that is where the doctor will look at, like some of them just want to go by your M spike,
Mhm.
the myeloma spike. And that's usually in a blood test shows up as your paraprotein number a lot of times.
Mhm.
So it depends on what type of cancer you have. My doctor looks at kappa for me. And
And for
then IgG, kappa, those are things that the doctor looks at, as
and,
well. But it depends on what type of cancer.
right, and for your cancer, you mentioned the kappa light chain, and the number was 10. Anything below that, you're starting
He
to worry.
he does not worry about starting treatment. That's my myeloma specialist,
Right.
at KU at University of Kansas in Kansas City. But he, it just, like I said, depends on what type of cancer. Some people don't express uh, the M spike in their blood labs, so they have to go by, their bone marrow biopsy numbers to find out what the M spike is, you know.
Mhm.
So it just depends on the type.
I would definitely recommend getting the bone marrow biopsy because
Mhm.
that would give them more detailed information. Remember, the blood is made from the bone marrow, or that's where your blood comes from.
Right.
So yes,
And
that's
it's needed. It is needed. You're right. I heard Derek say, you know, they need a baseline.
Right.
You know, just a baseline. It doesn't mean that you're going to be going in every few months and have another bone marrow biopsy, but they need a baseline typically to make a diagnosis.
Well, follow-up question to both of you then. The baseline is from the blood test or from the bone marrow biopsy?
All of the above.
correct. Yeah, they're all
They look at
components.
everything.
Right.
Now, my doctor says it's not necessary to have bone marrow biopsies frequently because he can monitor it through your blood. You know, if your type of myeloma allows that to happen. Some people don't have where it's expressed in the blood. It's secretory, or I don't know. Anyway, they have to go in to the bone marrow to find it, and X-rays. You know, like either MRIs, PETs, or something to monitor. You know, whether you have it in
I have
situ.
had full body PET scans as
Yes,
well to look for bone lesions
yes.
because what happens
I
is
just dialed in.
this will eventually affect the bones themselves and cause osteoporosis of the bones eventually.
And
Once it turns
lesions.
into a full blown myeloma and
Yeah,
lesions. Right.
Well,
it could be holes. Yeah, it could
Derek,
be holes in the bone, and it could be growths. You know how it's expressed. So that's why they want to do a scan.
right. Derek hit a major word there because I already knew I was diagnosed with osteoarthritis and osteoporosis early.
Okay.
And they should have tested that before they did radiation therapy. I've talked to other people that they've dealt with this. It's a year later, so you just have to deal with it. But I thought that was a major issue, but I think my oncologist is also worried not only about that, but the more serious issue is the MGUS and how that could be monitored right now. When I spoke with Rick's friend in California, he's never had the bone marrow biopsy, but he's had all these other tests, and his resolution was you don't need the biopsy, and everybody's different, as we're all indicating here, as long as they monitor it very carefully with the blood tests, depending on what it is, 3 months or 6 months or so. So up until this meeting, I thought I was to that point, but you're certainly helping me to realize I really have to reconsider some things and maybe do the biopsy.
Kind of
To
synonymous
make a
with
diagnosis, I'm sorry, to make a diagnosis, that's what I have read and have been told over the 12 years that I've had myeloma, is they need the baseline bone marrow biopsy and scans and your blood test to make a diagnosis of multiple myeloma.
kind of synonymous with prostate, where you have a PSA in the blood. Well, then you want to verify it with a MRI guided biopsy at that point. So yes, it's all components that you need to put the whole picture together and get
Right.
the end diagnosis properly.
Perfect. Thank you. Thank you. Thank you, Michelle.
Oh, it's everyone here. That's why we love these meetings because we can all gain so much from them. But bone marrow biopsies are not only for those who with MGUS or myeloma. It's all of us here have, I believe, with any kind of blood cancer have had them. I've had quite a few. Mary Lou, I believe you get them right, if I remember correctly. Barbell.
And I also have MGUS, Dan. I was diagnosed 12, maybe 12 to 15 years ago. And I was just monitored with yearly blood tests. I never had a bone marrow biopsy until I was diagnosed with MDS. And then I had a bone marrow biopsy, and I found a very small plasma cell protein in my blood. But I've had recent bone marrow transplant, and now it's just a minimal trace. They can't even detect it. So
this is over 12 years, Mary Lou?
yeah,
It's kind of,
yeah. Yeah. I was
You're,
just monitored.
and you're still at the MGUS stage or
It's still,
classification.
there's just a trace. I can't even detect it anymore. So
Oh,
that was because of the bone marrow transplant that I had.
oh, I see.
Which you
Yeah,
had for your MDS.
which I had for my MDS. Yes.
So
I
Michelle,
have to
and you,
say,
go ahead. Lou.
I'm sorry, for Dan and Derek, people who have been diagnosed with MGUS, it can be years and years and years until, or if ever it advances to myeloma.
Mm-hmm.
The leader of our support group here in Kansas City, it's sponsored by the IMF, which is a great resource too, to go to the myeloma.org website. That's IMF's website. But they have, support groups all over the country. And the one in Kansas City, the leader, Cindy, has had MGUS for over 25 years.
Mm.
And it has not advanced.
I had it for 4 weeks and then I developed it to Waldenström.
Oh, wow.
So it is different. It is different.
For everybody. And what happened with me is when I got my pancreatic cancer diagnosis, my whole focus shifted, as well as, and I'm seeing the same oncologist through all of this, as did his focus shift immediately. He said, "Oh, that MGUS, we're not going to even worry about that. It's now all about the pancreatic cancer."
Right. That's serious. Yeah.
Right.
So, what's the status on the pancreatic situation now for you?
I'm clear. No evidence of disease going on 4 years after my Whipple procedure. It was cut out surgically, resected with the Da Vinci robot. They didn't have to bust me open. It was done orthoscopically, and I just have a little different change in diet and the way I can eat things because my digestive processes aren't quite the same anymore. And then it also put me on insulin because I became diabetic because the pancreas is responsible for making insulin for the body, as well as all these digestive juices to break down fats and proteins.
Wow.
So I have a question. So we have Mary Lou who had MGUS, now has a trace, but ended up having MDS as well. Barbell, CLL, MGUS, Waldenstrom. So is MGUS a marker for more than multiple myeloma? Or is these just happenstance?
I think it's coincidental. I don't know I don't think there's any tie. But
They say that older people have a little MGUS always.
You're saying there's a chance that when you get older,
Yeah.
they have, but not all old people. Bell, you're not old. Come on.
Actually, Michelle, with the little research I've been doing, when they did the bone biopsy last week, they also put that word in Paget's disease. And so when I looked that up, there's also a connection between MGUS and Paget's disease. They're both bone-related conditions, but there's no strong direction or a causal link between the two. But it's like a lot of different paths that your body can go through.
Right. And I don't know of people in the Kansas City support group is like over 150 people who have myeloma or MGUS, and I have not heard people talk about a connective link. Uh, it, you know, I'm not saying it's just happenstance. Obviously, things can be connected. It depends. A lot of times you'll hear that your your system, can be such that it doesn't fight off any type of cancer very well,
Right.
and that could be through, what you've inherited, your genes that you've inherited. I always say I blame it on my Irish ancestors who were not fed very well when they were in Ireland.
You mean it's related to potatoes?
Yeah, well, just lack of.
But,
No food.
but it,
But I always blame, my not being able to fight off. It's kind of like I heard someone say, you're like the canary in the
coal mine.
Yeah, because you are more sensitive and you will express that uh, that other people that can fight off cancer do not have to, have that happen. But
But
who knows? It
but
could be environmental, it can be um, genetic, just your susceptibility to having cancer, which then could open it up to other types of cancers. So
right,
that's just,
and to follow up on Michelle's question, it can lead to myeloma, but it also can lead to leukemia. Is that correct? MGUS.
I'm
I
not
haven't heard
sure.
that. I
it
have not
doesn't,
heard.
Uh,
No.
there isn't a direct path. What happens is some of the treatments that you get for myeloma can change. Like my doctor had me on Revlimid for about 6 months after my stem cell transplant. And he took me off of it because he did not like the shape of my cells, my blood cells. He said, it's starting to look suspicious for leukemia. And he took me off of Revlimid because, it was known that sometimes the treatment you have, like Revlimid, can then cause a secondary cancer.
So what I was going to say is I've also got benign growths on my prostate, knock wood at this point. And in that, I'm in active surveillance right now with AnCan. And in that group, a gentleman or doctor came through, and he's currently doing a study, and he's studying the gut biome to find out if that is related to prostate cancer potentially. And
Mhm.
so you are what you eat. And my body likes to grow things, obviously, because I have all these different growths internally, as well as moles on the skin and growths externally as well. And so I'll be very interested to find out this doctor's results once he finishes his study about studying the gut biome to whether it is indeed related to prostate cancer. That's the only focus he's doing right now under his study. But
Mhm.
yeah, who knows? That could be the common denominator right there
Mm.
for a lot of
you know,
cancer.
Well, the gut
I
is
do,
part of the immune system, definitely.
I am, AI is saying there is a link, but I don't trust AI. But now I'm on Blood Cancer UK. Not that this is a doctor, but I believe this more than AI. And it does say there's a correlation with Waldenstrom's.
Mm.
But Barbell, you may know more about that. AI said there was also a link to leukemias and MDS. But again, I don't, AI I do not use for my reporting for research because you never know. It's only what's been fed, right? But this is interesting that just because I saw this correlation, so this is something I have to look into now. By the next meeting, we'll follow up with the discussion. We'll all do our homework and see um, if there is anything. But like you said, Lou, I mean, treatments can do things too. That's a great doctor that you have that was looking at the shape of your blood molecules. Unbelievable. That's like fantastic that they did. So, Mary Lou, I'd love to hear about what's happening with you. You look fantastic.
Thank you. I'm feeling very well, very well. I'm still on chemo. I am on chemo till September, but I've been in remission since November, complete remission. I'm 100% my donor cells, bone marrow. So, and I feel very good. I feel very good.
Are you still sequestered?
Yes, unfortunately.
For how much
I go
longer?
out. I can eat out. So outside. So we happen to be at our cottage. So we went out to eat tonight, and you can eat outside. Um, but I can't be around a lot of people. So and I'll tell you, I can't be out in the sun, which really bothers me. And I was out today just for a little while, and I had a long sleeve jersey, my pants on, and I was so itchy. I don't know if it was from the sun or what, but I said to my husband, I have an umbrella. It's a UVB umbrella that I usually use, and I left it in the car. I should have went and got it. But other than that, I'm feeling good, so I'm happy. I'm pleased. as long as it continues. Because
Now,
I also have a family gene, it's called Lynch syndrome. And with that comes a lot of different cancers. And in very small print on the bottom of the report, it says, and in some people, hematological malignancies. So I'm blaming my Italian ancestry, Lou, not my Irish.
Mary Lou, from what you had, your bone marrow transplant, is GVHD a possibility, graft versus host disease?
Right. Yeah,
And have you had that?
not yet.
Well, let's hope never.
Yeah, not yet. No, I've been fine. So,
And is that something that generally people would know sooner rather than later?
well, you can get it through your whole remaining life,
Yeah.
unfortunately. So that's something that can always pop up. But I think it's more prevalent in your first 2 years.
And too bad Jerry isn't here tonight. He could let us know, because I know he has studied that extensively.
The GVHD?
Because he has it, yes.
Oh, yes, that's right. He does. Yes. Yes.
He has all the secrets and humor around it, of course.
Yeah.
Secrets of treating it and his ice vest and everything else. So, well, you look phenomenal. When are you back at Dana-Farber? I would love to meet
I go back on the 23rd to start my fifth cycle of chemo. Actually, my sixth cycle of chemo on June 23rd.
Where am I? I think is that a Sunday?
Oh, it's a Monday.
Okay. I think I'm around. I have a speaking engagement out of town, I think the day before or 2 days before in Florida. So I think I would love to meet with you if possible. But that's not the day I have to pick up my puppy from obedience camp.
Okay.
Or as I call it, charm school. But you just look fantastic. Your coloring's great. And you can always tell when you have lipstick on, you must be feeling pretty good.
I got to put lipstick on.
I'm at Dana-Farber June 17th. Close.
June 17th. Yeah.
But I'm just writing a note so I can check my. But you have a treatment that day though.
17th.
So I don't know. No, you. So I don't know if I'd be able to see you. I guess I can see you before you go in.
Yeah, because I have everything that day: the labs, the doctor's appointments. I'm getting my 9 vaccines that day, and then the chemo. So I'll be a human pincushion.
You will. And are you feeling less fatigued?
Oh yeah, my fatigue was gone. Well, I would say December, the end of December, beginning of January. I was fine.
And are you on anything right now besides chemo?
Yes, I'm on some pills, but most of them are like vitamins, multi-ferritin, vitamin D3. So I am on still an antibiotic, and I'm on a antifungal.
It's great that you're feeling well, especially now that the weather is finally
better
here.
I think, that perks you up.
Absolutely. Well, did you have any questions for anyone or anything else?
No, I'm fine.
Great.
Thank you.
These treatments are, I keep hearing all these different treatments, and it's uplifting to hear that people are doing so well. And Sally had shared with us, she's doing well in her new treatment, although she's not, she's sick with, I know Alexa's here. I'm unsure it's more than a cold or a sinus infection, maybe. But anyway, Barbell, what is going on with you?
Oh, well, I still have these skin issues, and I wonder if anyone who has had MGUS or multiple myeloma, do you have skin issues? You do too. Yeah, because the the plasma cells travel to the skin, I guess.
Barbell, what are your skin
really
issues?
strange. I only have it on my lower legs, and a few over the body, but very, very little. And that is really strange. So I think These plasma cells must be in my feet or something. I don't know.
Do you
It
mean,
just depends.
can you explain what, if, I don't know if you want to, if you want to share that, but what do you mean, like, do you mean like rashes or petechia or something?
Well, sometimes it itches a little bit, but what is really strange, I get these blisters, uh, similar to chicken pox, which are filled with liquid.
Oh,
I usually pop them, and then but they take a long time to heal. So it's really strange. I have, but it's only on the lower legs. It was on the left leg. Now it's on the right leg as well. But nothing on the arms. A little bit I had on the back, but it's not there anymore. And in the front I have nothing. So it's just the legs. So I guess all the plasma cells are in the legs, in the lower legs, not the entire legs. Just feet and calves and. Are affected, which is really strange.
Is it a side effect?
Barbell, I'm sorry.
I was gonna say,
Barbell, have you been tested for cellulitis?
Uh, well, they did a biopsy, but it came back. They didn't know what it was. They couldn't detect it. You know, they took a biopsy last year already because I had issues, but it came in indecisive. They couldn't find out what it was. Well, they usually do it because you can also get T-cell lymphoma, you know, so you have to really check it if you have an issue. But now I know it's from the MCAS. But what really is strange, the skin issues I didn't have with the CLL. I had that, it started after my COVID infection. Really strange.
oh, is there,
2 or 3 months later, I had this already. Also, these blisters, really long, large blisters. But I didn't have MCAS then. Then I went into rehab, and in the rehab they already said, "Oh, it looks like you have MCAS. It should be looked at." And it was only like 2 or 3. When I came back from the rehab after about 4 weeks, I have a doctor come to the house to do blood tests in between the 3 months because my cancer doesn't go by the checkups, you know. And she said, I don't know. I don't want to take responsibility. So I sent it to the professor in the clinic directly, and he said I should come in for testing. And they put me right away in the ER because my protein was so high. They couldn't even do some of the tests. So, well, there I was again in the clinic. You know, I spent most of the time in the clinic last year, but this year is better. I'm feeling better. I can go, do everything in the house. I don't go outside is a problem because of the stairs because I live on the second floor. I've walked down already, but I need help. It's a bit difficult still, but as my IgM goes down, I hope I will improve. The CLL cells are not detectable anymore. They tested it last time already, so the CLL is not the issue at the moment. So it's more the Waldenström. But the Waldenström clone is a lot stronger than the CLL clone. They tested the dividing factor, Ki67, and it's quite a bit stronger. So I guess I have to fight it. We'll have to see. I'm on Brukinsa. It works very well, and I hope it keeps working, and I hope it is sufficient too, because I started out with venetoclax, and when it stopped, didn't work anymore that well because some of the cells just learned how to avoid it. I don't think I had a rejection because there were less than 5% less in the bone marrow of the CLL cells. So they stopped the venetoclax, and then this virus clone really started to sprout. And now that's what they're treating. But you know, the drug is for both diseases. That's the good thing about it. But well, I guess I have to keep taking it. The only thing I'm still looking at is adjusting the dose perhaps after a while because I don't want to get these mutations that you get with BTKIs.
You get mutations with them?
Yeah, with all of them. But you don't know when. That's the problem, because every patient is different. And some take it for a long time and don't have anything. Like Lund, for example, took ibrutinib for 8 years. He didn't have an issue. He had other issues, but he didn't have this issue with the rejection or mutations. But then others, they get it earlier, like after 10 months or 12 months, or it's always different, so I really have to watch it. But I just started taking Brukinsa since January, so it's not very long yet. So I don't think I'll have an issue at the moment. See what comes out next. My next appointment is next month. And the one in the clinic, I have a doctor come to my house on the 12th of June to do another checkup, but it looks good because all the other blood work is okay, and I have no other comorbidities, which is good. That's I'm only fighting the blood cancers, but is already plenty to do.
Well, you get a twofer with the Brukinsa, right?
Yeah, it's really good. It's well tolerated, definitely.
Well,
In
yeah,
the
Ash
beginning, I
just
had some issues with bleeding. I had nosebleeds for days. It wouldn't stop. But in the meantime, I don't have it anymore. No,
well
no,
in the
no. I
beginning
have sometimes a little bit of problem with hypertension, but then I take something for hypertension temporarily, and then I stop it again because I don't want the blood pressure go too low. Because usually I have rather a low blood pressure, but I think that's the only real side effect that can really happen is that you get a higher blood pressure. If you already a high blood pressure patient, it might be an issue, but I'm not. I never was.
so Barbell with the twofer, I meant that by you taking zanubrutinib, it can take care of both Waldenstrom's and CLL.
Mm-hmm.
So that part's good. Were you on a BTK inhibitor? I can't recall previously.
I had ibrutinib in my first treatment.
That's what I thought. Well,
Yeah, I had it only. I was only treated for 8 months. I went in with stage 4 with very high tumor burden, and after 8 months, I was clear. My bone marrow was fine, and the blood was fine. So I went off, and I was actually okay for 30 months, and then I relapsed. And then they put me on venetoclax and obinutuzumab. And after that, I was fine again. And well, after the COVID infection, which finally hit me at the end of the season, know, I stayed away from it for a long time, but it got me one time. I was feeling a lot better after the second treatment, and so I started, going out for lunches and stuff. Maybe that was not a good idea, but well, at home I can't get anything, so I haven't been sick all winter. They can't give you IVIGs because if your protein is high in the blood, they cannot give you IVIGs, even if your IG is low. I, IgG is low. I mean, so well, I'm doing pretty good, I guess, but
you are.
we'll see. I always stay good for a certain while and then I relapse, but this time I will really take care of it. I have doctor come to my house to check it in between. I go every 3 months for now almost 9 years to the clinic. But the funny thing was, every time I had the relapse, it was in between those 3 months. It just wouldn't go by the schedule. So that's why I have now an intermediate checkup, privately, just to be sure. I don't want to have another treatment. That's my fourth one, and that's about it. You know,
Well,
I live alone too. There's not much I can do. Of course, you can hire care or so, but I wasn't happy with the care. I had it when I got out of the hospital, but they don't do much. They come, they maybe wash a little bit your back because you cannot clean your back, and then they leave again, and then I still have to pay 700 euros per month, even though the insurance pays half of it, and I don't pay for that. I asked them to bring had a little bag of garbage sitting, and I said if she could take it with her to the kitchen, which was on the way out, and she said no, that's not her job. She's not doing that. I said no, I'm not going to pay for that anymore. But I have a neighbor who is helping me, like taking out the trash or bringing up parcels. So she does different. She goes shopping. She does different things, and I have Meals on Wheels, but not always. Once in a while, I cook, make something myself. But to cook for one person is a problem too. No. It's not that easy just to cook for one person, and well, I can do it now. I can do a little cooking now. I couldn't before. When I was in rehab, I just could make a pudding. That was it. At the end of the rehab, they had me prepare pudding.
Well, it sounds like you're progressing and that you're able to do some things you couldn't do before. And you sound a bit more I'd say, well, you're always energetic, it seems, Barbell, but you sound even more energetic. I don't know. Does anyone else hear that? But I guess that's,
I'm doing a lot of things, that keeps me active. I'm on the internet a lot. I have some appointments on the internet too, and Zoom meetings. I'm very active. I have my platform. So that keeps you busy. Like Lou, she's also busy, right?
Me too. Well, the ASCO then, that zanubrutinib had, they showed wonderful numbers about zanubrutinib and its performance for patients. It's
a good drug, I think. I mean, it's really a good drug. I like iputinib. I'm not sure which one is better because I have lower tumor burden now, and it works differently then, because the first trial I had a higher tumor burden, and I don't know if the Semiprit would have done the same thing. They work differently. They're different drugs. But it's a good drug. It's a good drug, and I think the combination Brukinsa and venetoclax could be a very good combination. They're already doing this in trials.
Yes,
and I think this is a very good combination.
It is. Trials have been showing good preliminary results on that as well. So, and Dan, as you're hearing, some of these drugs are used across different blood cancers. Not all of them.
Venetoclax is anyway. It's also used in AML.
Well, and
always depends on the type of disease you have, because there are so many varieties.
Well, multiple myeloma too, right, Lou? Venetoclax?
Yeah, multiple myeloma is not one disease either. It's just like in CLL, there are so many different kinds.
So, Barbell, when do you go to the doctors next?
On the 12th of June, one doctor is coming to my house to do blood work.
That's soon.
But yeah, that is soon. And then at the clinic, I think it's the 17th or no, I think it's the 7th of July. I have an appointment at the clinic. And they also do a test again. I think my IgM is really going down, and I hope it's in normal range. But that doesn't mean that the plasma cells work properly. What I really wonder, if that originates in the B cell, or is it a malignancy that occurs in the plasma cells later? Do you know that, Lou?
Sorry, repeat that question.
I wonder where this problem with the IgM occurs. Does it occur already in the B cell, or later when the plasma cell is developed?
I'm not familiar. I'm not sure. I know that IgG, as the plasma cell related, but I'm not really sure about what you just asked.
Mm-hmm. So it's if
The
your
B cell, I'm not
IgG
sure.
if your IgG is not in normal range, it's actually a plasma cell disorder already.
Well, it's related into the type of blood cancer that you have. So, as far
Mm-hmm.
as cellular, I'm not as familiar with that. Maybe Sally would be able to answer that question better than I can, but I will certainly look at it.
Mm-hmm. I would be interested, if that happens later or if it's something that is still in the B cell because with the obinutuzumab, they wiped out all the B cells, more or less, And so they said, well, hopefully healthy B cells come back. And so I wonder, were these B cells healthy or not? I mean,
Good
the
question.
IgG was still low, but that doesn't necessarily mean much because when you are older, your IgGs go down anyway, because of age. And then also, even if you have a high level, maybe they don't function right.
Well,
True.
So it's a very limited value. It doesn't tell you that much. I will
um,
see. I'm
well,
still investigating, as you can see.
oh, so next meeting, you'll have to share that info with us, both
Yeah.
whatever you find, Barbell. That'll be fascinating to learn.
Yep.
Because a lot of us need to get immunoglobulin infusions with CLL and also
Hmm.
with multiple myeloma. I don't know. What about MDS? Mary Lou, have you
No,
ever had to do that?
no.
I had mine today, so I'm losing my steam quickly here. I don't when I yawn, it's nothing personal to any of you. I've just had a it was the set it went until 6 o'clock, so it was recently that
Yeah, but
had it.
you can't really tell because my doctor wanted first of all to get the IgG up, way up, so I wouldn't have any issues in winter. But now they can't do it because of the IgM being too high. But I wasn't sick, so I wonder, if it's really necessary always to substitute IgG and what are the recommendations? When do you start? Do you only go by the value or what? Of course, if you have a lot of infections, it's
Right.
clear, but I'm not really sure what role this IgG plays, when you normally, I mean, if you are always sick, you need something to help you, that's for sure.
It is. Well, thank you, Barbell, for sharing. Lou, you have had a fascinating last, is it 50 days? 51 days. 50.
Boring, actually, which is good. That's what the nurse practitioner said today at my visit. She's when my labs came back, blood labs came back. I don't have my Kappa and IgG and all of that back yet, but she said, "Yeah, you're boring," and she said, "That's good." So everything is going in the right direction. So that's good. The 50 days, the worst part, I have to say, of the follow-up CAR T, kind of thing is 8 weeks of no driving.
Oh,
So this is my third time having the 8 weeks, because I've done 3 CAR T, and that's an FDA rule because neurotoxicities, can be an issue. So they don't want people behind the wheel that may all of a sudden have a forgetful episode, because of a neurotoxicity. So for 8 weeks, you have to agree when you do a clinical trial or a CAR T, you have to agree that you have someone who can drive you, back and forth to the doctor visits and so on. So I get to drive next Wednesday.
you've been counting down the days.
Yes, my husband too.
I bet.
Typically in our family, I'm the driver. I'm very much, I look ahead, I watch, people merging, I'm a very defensive driver. Um, my husband is a little bit of a talker, so he likes to look at things and that, so for our marriage's sake, I So for the 8 weeks, I have to be very good about not saying, put on your turn signal. We need to turn here. Oh, remember they're working on, state lines, so we can't go that way. I guess it's not that I worry. It's just that I watch for those things ahead of time. And some people in our household, and there's just two of us, some people in our household, they don't really sometimes think ahead. So a backseat driver, I guess. But it's been really, I have to say that as far as side effects, I've heard, the worst can happen. Your fingernails for this particular CAR T, the GPRC5D, your fingernails can turn blue and fall off. Your toenails can also do that. There can be loss of taste for like 6 months, and skin issues, inside the mouth issues, um, and at its worst, which put this particular trial on hold. Um, they have had people with neurotoxicities, issues with walking, speech, those kinds of things, and it put this on hold just before I got my cells back, and so we had to do some really hard thinking about should we proceed, should we go through with this CAR T. David was saying, I don't want you to have permanent problems with walking, our speech, our vision. That was the other thing. So it wasn't easy this time to make this decision. But so far, knock on wood, so far so good.
When do those usually happen early on or after?
I've heard some of the people talk about, after a few weeks that they start to surface. And my doctor, who's in charge of the clinical trial at the BMT clinic, said if you make it to 2 months, the possibility of it cropping up is very small. But I have been talking to people who said their fingernail issue didn't start until like 2.5 months. And then it took time, for that to get worse. Uh, but as far as taste, I was talking to a person today and they said they lost their sense of taste at 2 weeks and they just got it back. And it's been 5 months. So it's, neurotoxicities can happen later. It's not, and, when I had the clinical trial for teclistamab, the bispecific, I did not develop neurotoxicities in the hospital. It happened at day 39. So, and it was
And
like forgetting stuff, and not being able to write well. So,
and were those temporary?
yes, as soon as the doctor took me off of the bispecific shot, it was shots that you got every week. As soon as he took me off, it stopped within a week, those side effects.
Does that mean it crosses the blood-brain barrier?
Yes. And that was a concern for the severe side effects for this particular GPS C5D clinical trial. So and that's why it was put on hold, because whenever you have neurotoxicities. It's passing that barrier. And the most concerning part was that it was some of the people that got it. Dr. Shanae said that out of 10, 6 were it was temporary. 4, it was permanent. That they have not, since they did the trial, they have not gotten rid of those side effects: walking, speech, vision. And it's not all of those, it's just some people get certain things. So it was, my husband, he did not want me to do this trial. He was really, really worried. And he has never said that before with any of the other clinical trials. He just said, I am scared. Today, he was just the first time I've heard him say, I think I can stop, being worried and scared. And he's been on the edge of his seat, during this for the last more than 2 months, because we had to make a decision beforehand. So, those of us that go through these clinical trials and or just a new treatment, we have to be knowledgeable and learn, about these treatments and talk to people who have gone through them and research, with reliable sources, obviously. But these are big decisions. Some of these treatments do have side effects, and some people do not want to deal with that possibility. I think everybody's makes their own decisions what's best for them, and with the guidance, from your medical team and what you learn.
Not always easy to find people to talk to who have been on one.
That's true, but I dig. I talked to people who went through phase 1 at City of Hope with this clinical trial, the phase 1. I'm in the phase 2 part of this clinical trial. So I was able to connect. And I think that's something that I think we can do better at making connections. And the more we are involved in support groups like this one, and other, groups, I think it connects us to people who know people. They may not be in these groups, but who know people who have gone through these treatments and connect you, to those resources.
Mary Lou, is yours a clinical trial?
Yes.
I thought so.
Yeah.
Did you speak to anyone who had been on it?
No, I did not.
Yeah,
But it's been a clinical trial for a few years. Dr. Jacqueline Garcia is the one who started it. I don't know if you know who she is at Dana-Farber, but and all it is azacitidine, but it's azacitidine and venetoclax. I take azacitidines for 5 days and venetoclax for 14.
I've read some of her things of what she's done, but I mean, it is a great idea to do that. I met someone after that didn't really help a whole lot, right? But it would be great if they can do that. But of course, they can't without people's permission, right? So, like you said, Lou, the best way is this way, but that's not always easy. I try to give shout outs. Is anyone on such and such a trial, on social media to help others. But that's good. It's a good reminder to all of us to do that. So you go back in, you get to drive next week. Maybe we should all stay off the road. I don't know. Or maybe we should be staying off the road now. Now we should be staying off the road. Until we get back behind the wheel.
No, it's a good thing. I'm excited. I know when Rick had said, what fun things have I been doing? All I could think of is I get to drive again.
That's huge. That is.
So it's just a journey, and that's what David, we titled our book, Living with Hope, a Myeloma Journey. So it's a journey and it's living with hope. It's like you've got to think beyond, what's my favorite thing to say is, okay, what's the next step? What's next? What's next? Those are the things that I ask my doctor. When my numbers don't look good, okay, what's next?
It's true. Mary Lou, have you been able to drive the whole time?
Oh, yes. Yeah, I couldn't in the beginning, like the first 3 months, but after that, yeah, I've been driving. Yeah. I have nowhere to go, but I'm driving.
That's how I feel sometimes. Nancy, did you want to share anything this evening? I think that's Nancy on the phone.
Have it on my...
Maybe not. Jim, you had wanted to share something this evening.
Yes, update on my sister. Okay, my sister, Tulsa, Oklahoma, multiple myeloma. It got into her brain. And so they had to do surgery, got it out, or got most of it all out. And about probably 10 days afterwards, she was back in to do radiation, which apparently did a lot of good. And then she did chemo. I don't know if it was for a week or 2 weeks. And the progress report looks good. I think she still has some of it in the brain, but it is receding. So how long that will continue, I have no idea. So, but she is coming out of it though. I mean, it's amazing. She's tough.
It sounds like it. I think it's more rare to hear about myeloma going into the brain. I think it's pretty rare. Did her doctor say that?
Yes, supposedly it got into the spine, and then it happened to go up through the spinal canal. They believe so.
What's her attitude, Jim? Is she pretty positive?
Oh yeah, yeah. As I say, she's had let's see, hepatitis C, breast cancer, skin cancer, now the multiple myeloma, and as I say, she's a trooper.
Yeah.
Wow.
Well, I'll keep her in my thoughts.
Yeah.
Does she have children?
Yes, she has a son who is great and a daughter that, well, we won't talk about the daughter.
But she has
anyway,
people with her.
The son is over within Arkansas. She's in Tulsa. So he is probably about 80 miles away. So he can step over there and he is assisting her. So, yeah, there is a support system out there. Thank heavens. But that's it.
Well, that's good news. Much better news than you had last time.
Oh, I know.
Thank you. And how are you feeling?
Now well, now that's a different story. No, that's a better story because actually, I am going on 8 years, stage 4 prostate cancer, approximately 5 years into it. I stopped all treatment, went on to a holiday, and it turns out that my testosterone has not recovered. In other words, the family jewels, I believe, have given up the ghost, which is actually good, because if they didn't, I would have to start up on treatment again to put them back into then hibernation. So because of that, with the low testosterone scores and with the PSA for a year now has not gone even above 0.1. It's below 0.1, which is good. So I am just writing this out as long as it stays below 1.
So,
Is that
Michelle,
Huh?
Michelle, you've got to ask him how long his bike rides are now.
Well, actually, they aren't that long because of the heart condition. I also found out that I have a leaky tricuspid valve, and I have been learning all about heart issues, ejection fractions, and all kinds of things. So,
a whole new language for you?
oh yes, on the heart side, but anyway. But I'm
Well,
still active. I'm still volunteering at the thrift store 2 days a week, 3 days at times. I still do all of the volunteer work, and we're helping out veterans.
and are you bicycling at all? Because you used
Yes,
to.
I am bicycling, but it's down on a fixed course. I always do a fixed course, and about approximately halfway through, I stop in a park and I rest, because then by the time I finish this fixed course, if I feel good, I know I am possibly improving. If I don't feel that good, I know that I need to probably exercise a little bit more. So,
All right. Now, we have someone called Caller One. I think it's Nancy, and I can't unmute her. Lou, can you? I've been trying to unmute her. If it is,
We can't unmute people.
oh, uh-oh. Well, gosh. That's not good. So we can't unmute. We can only mute?
mute.
Yeah, we can mute people, but we cannot unmute them.
Oh, no. Well, Nancy, if that's you, can you hang up and call back? I'm so
Yeah,
sorry.
that would be the best thing.
I'm not sure if that is Nancy, though. And if they're calling in, then they can't chat. Put something in the chat if it's them. Wait a minute. Nancy, if that is you, send me a text. Let's see. Oh, it is Nancy. Oh, gosh. That's right. Your phone will not unmute. I guess the only way would be to hang up and hit redial.
Hang up and come right back. We'll wait for you.
Said you.
I'll kick you out right now.
You're saying you all are great storytellers tonight. She said, no problem, she's good. Oh, and you just kicked her. Nancy, please. Oh, she's gone. Let's see if she comes back. So Dan, now you've met part of our merry group. We have a lot more, and I hope you come back for our next meeting. It's the first Thursday of every month. I believe it's, let's see the date. The next one is July 3rd. Oh, great. I have another infusion that day. I think I'm on a roll. Being
Boy, it's not a good day for you. Infusions and then a meeting. Thanks so much for all this information. I really appreciate it. It's good to hear from everybody. And I'll certainly log back in next month.
Okay.
It's great to have you here.
Thanks so much.
And thank you, everyone, for joining Everyone's looking good. And we'll see you all. I know I think a lot of us have doctor's appointments before then. Mary Lou, I'll see about meeting up with you. And Nancy, oh, there she is. Yay. But you're muted. And Nancy, I'm going by hook or by crook, I will see you this summer and meet you in person, but I may see you here before that. It depends. I know. And we can't unmute you is what Alexa just said. This happened to you one other time, I think. Bless you, Barbell. Nancy, did you have anything oh, there you are.
Yeah, I think I did want to unmute. So
yep, you did.
Yeah, I don't know. My audio tonight's been really weird, but I heard everything on the call, and you guys told some great stories tonight, some really hard stuff, and really just powerful how strong everybody is, and how, I don't know, I just so encouraged by hearing what you've been through. And Jim, I was really happy to hear about your sister, just an update on her, which is not great, but it's still, she's tough. And so, and I had my oncology appointment a couple of weeks ago, and they did the year out clonoSEQ to see if I was still UMRD, which I am. I got my results, and I'm in great shape. And Jim, I also relate on the heart issues, because next week I go to see an electrophysiologist. So
how come?
Because I've had the tachycardia, the SVT, and I'm now on a very, very small dose beta blocker. But yeah, Jim knows what we talked about this last month. And but my plan is, I see the electrophysiologist on the 11th, but I'm running away on the 15th. So he'll have to catch me in the fall. So I'm good. I mean, I feel very blessed. And Mary Lou, I did want to ask, did you cut your hair?
Oh, we can't hear you. You must have muted yourself, Mary Lou.
Yeah, I did. Yeah, no, it's growing in from chemo.
Okay. So. I love it. It's got this great, like, spunky, and one time I drew a picture of what I'm going to look like in heaven. And I have like green hair on one side of my head that comes down to about my waist. And then on the other side, it's really short, and I have a blue mohawk. I'm super excited about my look.
Oh, no. That sounds like a fun picture. Do you have that to share right now?
It's in Abilene. It's in Abilene. It was kind of it was like, it was a little vision quest I was on. But the other nice thing about it was I don't know what my body looked like so much, but whatever it was like dripping and diamonds and white, just it was all white and just really cool. And I looked really happy and young. I looked really young.
Everyone's freezing on the screen. Well, you're still young, Nancy. Younger. You looked younger.
Oh, I love the age I'm at. I love it, but I enjoyed being a child. I love the energy I felt as a child, like on the playground.
Why did you draw a picture of yourself in heaven? Was this like a class where you're supposed to do that?
I'm trying to remember. It was, I think it was, I do a lot of trauma work with other people, and we do a lot of just asking, what would this look like? It was definitely during a session on trauma that I was working with a teenager. And so I think it was, just, what came to me. And so I don't know, it was kind of it was weird.
It sounds like a great exercise, though.
Yeah. And I think it was pre-diagnosis. I don't even think, I think because that was, yeah. I'll show it to y'all some month when I'm at home and I have that notebook close at hand.
Or shall we do something for all of us for the trauma we've been through?
It is very healing. We can often draw what we can't describe. And that's why children can do so much good work with a set of crayons to express issues they've been through.
Even if you can't draw?
Absolutely. Stick figures are the best.
And scribbles. You can do a lot with scribbles and stick figures.
Mm-hmm. And you can break those crayons too.
That's right, and color outside the lines.
And we don't have
always. I like that. So if we do like a New England retreat, can we all draw?
Absolutely. Yeah. Yeah.
Okay. Sounds good. Well,
I think a lot of people do writing. That I know that I just messaged with Alexa about the writing group.
Right.
But for me, journaling, and that's where the book came from that David and I are.
Yeah. When is the writing group? I haven't seen any.
Next Thursday.
Next week on Thursday.
It's next Thursday, yes.
I can't come. It's Susan's fundraiser.
Oh, okay.
Kicking Cancer in Heels co-founder. It's her annual fundraiser for her nonprofit called Uncommon Threads. But Nancy, you won't be here yet.
Nope, not yet.
And Mary,
but I will tell you, because I don't think Barbell. I don't think sometimes she just won't beat her on drum, but I did not realize she has her own on her face or through her Facebook page. She has set up her own bulletin board type site where you can. She set it up into all kinds of categories and compiled all the articles that she finds, and it's amazing. Not to mention that she is also a creative writer, but she definitely is got a ministry of helping people through cancer. And I just been seeing her articles on her Facebook page, but I finally asked her at a meeting, and she said, "Oh yeah, I have it," and now I'm a member of her group.
You don't have to be a member. You can only access the page too. It's open access because it has a lot of information, and it's a holistic approach. It's not just medication and problems and side effects and all this. It's also like exercises, recipes, studies, everything. I have two lists in English and in German because it's an international group, and I have patients. In 2 months, it's 4,000 now who visit the page, and they are from different countries. They're from Africa, from Asia, from a lot from Germany, from Switzerland, Austria, from the States, from Great Britain, from Canada, just from everywhere.
International.
Congratulations on that, Barbell. That's really great.
Because I think, CLL doesn't go by race or nationality.
It's very true.
And Lou, you will love the creative writing group. It is so nice. I'm going to miss it this next week, but I really, it's kind of like this, except that we're all writing about certain things, and it's so well done. Who's the moderator, Alexa?
It's Regina Gordon, who's a published author.
Yeah.
So is it always the second? Is it the second Thursday?
Always the second in the month. Yes, second Thursday.
But then
It's 5 o'clock Texas time, so I don't know what time that would be for other people. That's Central.
6 p.m. Eastern.
For me, it's 12 o'clock at night.
Yeah, I have a friend who just signed me up for a golf league on Thursday night. So I'm for the summer, and when it's nice out anyway. When it's raining, I can do it. But it's every Thursday. Like I missed it tonight, and this would have been our first night doing it, right? I'm like, I'm sorry, I have to miss it. She's not happy with me, but yeah, that
Well,
would
I'm
mean I have to miss it.
I'm hoping to be there.
I would love to. I really liked it when I attended it. So it's the second. That's right, second Thursday. I just have to put it on my calendar. Okay.
Well, you are signed up for reminders, Michelle.
Okay. That's good. Thank you, everyone. I haven't seen a reminder yet, but then again, has it gone out yet for this one? It has.
Yeah, we do a 1 week, and then we also do right before, like a regular reminder.
Okay. Maybe it's in the millions of emails that are there. Thank you all. Thanks for being here. We really appreciate it. And we'll see you on July 3rd. Is anyone going away on July 3rd? I hope you'll be with us on July 3rd.
No.
We'll see you then. I hope everyone does well during this next month and continues to get great blood work back. Wish me luck on June 17th that I can join your club, the UMRD club.
Yes. Praying you in.
Thank you. I have never reached it. It's one of my goals in life, or at least progression-free survival, but UMRD would be great for a deeper remission. So, but anyway, thank you all. Thank you, Alexa.
Thank you. Have a good month, ladies.
Bye.
Bye.